So all that's left now is to close, and we're really fortunate to have Professor Helen Cross with us. Helen is the Director of the Institute of Child Health. She's also the Prince of Wales Chair of Childhood Epilepsy at UCL, and she is also an honorary consultant in paediatric neurology at Great Ormond Street. Thank you, Helen.
Thank you very much. And it's an honour and privilege to make the closing remarks, but I promise I won't keep you too long. I mean, my first reaction is, wow, what an amazing showcase. It really has been a showcase of work that has been undertaken within the Biomedical Research Centre. And what's really clear is that it's meeting the remit of showing true translation from the bench to the bedside and, of course, back again. What's always very difficult is to show true impact of what is going on. And I think the work with the young people, the wonderful talk and the video that we saw really highlights that. And I think really the last talk is fantastic at illustrating the real way of how to involve our patients in how we move forward. I think we have to bear in mind that this has been a showcase and probably really the tip of the iceberg of what is really going on, courtesy of the work going on in the BRC. And this is really working across a true partnership between the Institute of Child Health and Great Ormond Street Hospital. This partnership is the largest concentration of child health research in Europe. It's in the top 5 in the world. And the BRC is really important to enhance that partnership, really allow us to look at true translation and help the patients that many of us have been looking after for so many years and to date haven't been able to do anything, but now many specialties are turning into what we call interventional specialties rather than symptomatic specialties. And I can tell you neurology is not alone, is one of those, and it's really exciting to see. I think, the work will continue. It needs to continue. I know that over the next 2 years, we will be looking to move towards the next iteration, whatever the NIHR will request us to do. We have to thank the NIHR for the funding, and long may that continue with all the exciting work that's going on. So on that note, I want to thank not only the NIHR, of course, for funding, but thank all of you for joining us, for you particularly for sticking it out till the end. But I know there are a lot of people online as well, so thank you to them for joining. It only now is for me to welcome you to the Williams Lounge for drinks and canapes. I look forward to joining you at future events where I'm sure we'll show more than a little snippet and more of a showcase of what's going on. We do want you to feedback as to what you've seen and what we need to do in the future. So a survey will be sent round to those of you who've signed up, and there's a QR code, I understand, going to be put on the slide for you to link up and address that survey. Thank you very much.